Let's understand the facial nerve through schematic diagram. So remember, we have the 12 cranial nerve. The first two cranial nerve origin from the cerebrum. The next two nerve, that is third and fourth, arises from the midbrain. 5, 6, 7 and 8 cranial nerve arises from the pons, and 9, 10, 11 and 12 arises from the medulla oblongata. Now let us say our facial nerve arises from the pons. So I just draw the pons outline. This is the sagittal section of the brainstem showing the midbrain, pons and medulla. This is my midbrain. This is my pons, and that's my medulla oblongata. That's fourth ventricle. That's the cerebellum, and that's the brainstem. So our facial nerve arises from the pons at the lower part of the pons, say somewhere at the junction of medulla oblongata and the pons. Let us say this is the origin of the facial nerve nuclei, or this is the area for the facial nerve nuclei. The facial nerve takes a turn and arises at the junction of the pons and medulla. This turn is because we have another nerve nuclei, that is the abducens nerve. So let us say this is the abducens nerve, that is the sixth cranial nerve. This sixth cranial nerve is present along the pathway of the facial nerve. That's why the facial nerve has to take a turn around the nerve and come out. So it produces a band. This band is called as the internal genu. Once the facial nerve comes out from the lower part of the pons and the upper part of the medulla oblongata, it goes along with the vestibulocochlear nerve into the internal acoustic meatus. So let us say this is the internal acoustic meatus, and let us say this is the vestibulocochlear nerve along with it. So let us say 5, 6, 7, 8 is this, and I have the 5, 6, 7 cranial nerve. Both this nerve along with the labyrinthine artery. So let us say this is an artery enters into the internal acoustic meatus. Rest of the course of the facial nerve is inside the petrous part of the temporal bone. So I just draw the petrous part of the temporal bone. And this is, say, the external ear, external acoustic meatus. So this entire part is called as the petrous part of the temporal bone. This is the internal ear and that is the external ear. Okay. Now the facial nerve, after it goes inside the petrous part of temporal bone, it turns again and goes into the middle part of the ear, that is your middle ear cavity. So let us say this is the middle ear, this is external ear, and this is internal ear. Once the facial nerve enters into the middle ear, it turns and produces a dilatation. So this dilatation is called as the ganglion. So this ganglion is called the geniculate ganglion. Geniculate, genu means bend, so again you have the bend. You have a bend inside which is called internal genu. This geniculate ganglion is called as the external genu. The facial nerve, after it meets the geniculate ganglion, turn towards the posterior side of the middle ear. So it goes to the posterior side of the middle ear, remain there for some time, and then go straight out through the base of the skull through an opening called the Stylomastoid Foramen. Through the Stylomastoid Foramen, the facial nerve comes out and it goes just below and behind the external auditory meatus and enter into a gland. This gland is called as the parotid gland. So I am just drawing the parotid gland outline. Once it goes to the parotid gland, it divides into 5 branches. So let us say these are the 5 branches of the facial nerve, and this is the termination of the end of the facial nerve. This branch which goes to the temporal bone is called temporal branch. This which goes to the zygomatic bone is called zygomatic branch. This which goes to the cheek area, so we call buccal. This which goes to the mandible is called mandibular branch, and this which goes to the neck is called cervical branch.